Stammering, though it is common in childhood, is often viewed with a little negative notion. What is stammering due to? Let us see in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a health related topic is explained via video. If you want to see such videos, subscribe to this channel. Also, press the bell icon adjacent to it to get instant notifications whenever new videos are released. This week's video is about stammering. There are multiple synonyms associated with it. Stammering is sometimes called as stuttering, sometimes called as disfluency. Technically, it is now called as childhood onset fluency disorder. So what happens in stammering? Sometimes you repeat the syllables. So when you want to say unhappy, probably you say and then complete as happy. Sometimes you prolong the sound and then you complete the sentence. Sometimes the words get stuck. They don't come out. They just pause in between. People think that they are not able to, it's a language disorder, so they don't have the appropriate word. No, they have the appropriate word. For fear of stammering, they are not able to blurt out the word. What happens usually in childhood is called developmental stuttering or developmental stammering, which usually happens between the ages of 2 to 4 years. It's more common in boys. Almost 1 in 10 children do stammer at some point of time. But the good news is this tends to get better as they get older. The probable reason is there are multiple neurological pathways in brain which are concerned with the speech production. When these pathways are immature, probably because of the immaturity of the nervous system, you stammer. The factors associated with stammering are sometimes it is familial, though it is completely not genetic. Like if you have an identical twin, the twin is stammering, the other twin also will stammer. No, it is not like that, but there is some amount of familial inheritance. It tends to get worse when you speak to a person of authority, like when you speak to an unknown person or to a teacher, but doesn't mean they have any psychological problems. They are psychologically normal. So even though this may impair their scholastic performance, their intelligence is also absolutely normal. As I said, it gets worse when you speak to some person of authority, when you are asked to read aloud, when you are asked to speak in an unfamiliar environment. Like in a class, they may stammer, but in front of their friends, they may not. So, how to get rid of this stammering? Almost 65% can get better, especially if the kid is less than 5 years of age. So, their chances of getting better is much higher. If the kid is less than 5 years of age, usually the treatment is also directed at the family, not directly at the kid. So, we create an environment which is conducive to reduce stammering. So, what should you do? Essentially, there should be no judgmental approach. So, if they are speaking, allow them to complete the sentence. Don't complete the sentence for them. Don't react negatively. Don't scold them. You are speaking too fast. Speak slowly. No, don't say any remarks like that. Have a relaxed home environment where there are many opportunities to speak. Allow them to speak in their familiar environments. Like allow them to play in front of their friends. They may be fluent and they may lose this stammering. Always kids learn from adults. So you speak in a slow and relaxed manner so that they also understand to speak similarly so that the stammering is reduced. Give consistent feedback, especially if the kid is older than 3 years, but don't be judgmental. By doing all this, you can probably help the child. But if the kid is older than 5 years, probably the kid needs help from speech language pathologist or in our country simply speech therapist. But if you start the treatment late, the prognosis or the outcome is usually not good. So how to identify who is going to benefit and who is not going to benefit from starting treatment early. So whenever your kid has a stammering issue, follow the guidelines whichever I have told you, but still get them to a pediatrician so that he may assess for any coexisting neurological abnormalities or about the severity of stammering and may offer help with the help of a speech therapist or a speech language pathologist. But if stammering happens in a new onset in older children or in older adults, it usually signifies more serious disorder. More often than not, it can be due to a problem occurring in the brain. So in such instances, kindly visit your physician or a neurologist so that you may be examined in total and may identify the cause for such stammering. Friends, hopefully this video would have been useful to you. If you like this video, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.